So welcome, everyone. My name is Neda Amidi. I'm one of the co-organizers of this first Wearable Expo we're having here at Plug and Play. I'm going to try to do my best of doing the opening of the expo. Usually Saeed Amidi, our founder, does it, and it's hard to try to beat him at it, but I'm going to try to do my best. So, what was that? Yes. So how many of you over here know what Plug and Play is all about? Raise of hands. Okay, good. Good number of people. It worked. Very good. So Plug and Play is an accelerator. We accelerate high-tech startups, and we've been around since about 2006. And we offer to startups investments. We make investments ourselves. We provide mentorship, and we have VC partners that also co-invest with us. So since 2006, we've accelerated about 1,600 startups. We've invested in about 250 plus companies. And the total value of our portfolio companies' funds raised has been $2 billion. And you'll see a few more stats over there. A lot of you may be wondering why we're here today and what's Plug and Play's interest in wearables and health. Besides the fact that wearables are, on headline news with Intel acquiring Basis just recently, and Samsung and Apple, trying to beat each other at being the, number one smartwatch. I myself also have a personal interest in wearables. I wear my Fitbit Force every day. I don't leave the house without it, and competing with my uncle, grandmother, cousins, and friends. So it's something that's changed my life and changed my behavior every day. So besides that, we all know it's a very hot space, and Plug and Play's interest is to kind of invest in these companies and use the Plug and Play ecosystem to help these companies grow. So this will be one of a series of events that we'll be having here. And through these events, we're going to have around 5 investments in 2014 in this particular space. So again, welcome, and I hope you have a great time. We have about 25 companies that will be pitching and a great panel. And now I will hand it over to Julian, another co-organizer of this event, so he can introduce the panel. Thank you.
Can you guys hear me? Okay. So I am Julian Blaine. I am the director of Gizworld, it's a wearable computing consultancy. So I actually reached out to Saeed Amidi a few months ago, and I asked him, I said, are you guys doing anything about wearables? And he said, we might. And then I met him, and he said, let's not do one event, let's do 4. So here we are, and I think we've got some really exciting startups today. And I hope you guys are as excited as I am. So with that, I would like to introduce the panelists today. We have Jesse from Home Signal. Thank you. And then we have Gasper de Klerk from NVP. Then we have Monisha Prakash from Lumo Body Tech. Thank you. And then we have Jason Saj from Jaybird. And then lastly, we have Silpesh Patel from Breathometer. Well, first of all, thank you everyone for being here today. I think when it comes to wearable health and fitness, there's a lot of very interesting companies in the space. I don't think that anybody has really, cracked the code yet, because it's just, in my opinion, if you look at the activity trackers today from Fitbit, Jawbone, they're still not very intelligent. They're not really going beyond the data as far as steps and calories. But we're starting to see some companies that are actually going to be here today. We're starting to make sense of all the data. So, but before we do that, I would like to maybe ask Jesse from Signal to show us a quick demo of the smart T-shirt.
Okay, thank you. And we'll start with a little video that we cooked up.
What if life became a little smarter simply by putting on a shirt? What if being connected meant really being in touch? What if what we wore helped us get through life a bit more smoothly? Or be healthier, fitter? Imagine if our clothes helped us take better care of our loved ones. Or on demand provided that crucial medical information. Or maybe brought us together in magical moments we simply could not have before. Well, Signal is making it possible.
So I think that the reason that we're all here today is because that's a future that we want to be a part of and that we want to actually help to come about. And so today, I'd be really happy to show you our app, and I'll be walking around afterwards. And if you sign up for pre-orders for the spring, for this day only, we're going to put up a website so that you can sign up with your emails, and we'll give you a discount, and we'll make sure that you're the first to know when we launch our campaign.
Well, great. Well, thank you, Jesse. So maybe Monisha, would you mind showing us a live demo of your application and tell us how it works? And
Sure. Do you want me to do my live demo now or in
yeah, I'd like to do it now because after we're going to go into the panel discussion, if you don't mind. Yeah.
Sure, happy to. So I'm Monisha Prakash, co-founder and CEO of Lumo Body Tech. We have two products. They're both posture and activity trackers. The first product is Lumo Back. It's worn around your waist. I have one on underneath now, my dress. It's very discreet, you can't tell. And we also have the Lumo Lift, which we just announced. It is this very tiny, stylish, magnetic clasp. And it also tracks your body positions to a very high degree of resolution and accuracy. And it's able to give you feedback on your posture. When you slouch, it vibrates to remind you to straighten up. Both of these products are self-empowerment tools. They are meant to help you be the healthier, the more confident, the more attractive you. And with our day-to-day lives, when we sit in front of the computer for long periods of time, slouched, it has profound implications to your health and well-being. Posture is correlated to back pain. Back pain is a $50 billion a year problem. It's the second most common reason why people go to the doctor. It's outnumbered only by the common cold. And posture is also correlated to confidence. In fact, when you hold yourself up in an open, upright position, there's research that shows that you get surges of hormones associated with power and confidence. You also get decreased levels of cortisol, which are related to stress. So there's profound implications for why posture is important. But as I said, the hard part is remembering. And so our products, how they work, is they track your body's position to a very high level of resolution. And this is the part where I can do the demo. So if you can please switch over to the app, Jeremy. And it says, I'm not connected. Let me get closer. We were ideally supposed to have the device on stage. Let's see. How are we doing? Do we have connection? Great. Just let it catch up really quick. sometimes, okay, here we go. So this is me. It's connected to my Lumo body, to my Lumo back. And as you can tell, it can track steps. If I stand, hang on. If I stand, it can track it. Sorry, there's a little bit of delay because of the distance between my device and the app. And if I slouch, maybe with some delay, it'll show that. Let me just actually go closer to my device, to my iPad, and there shouldn't be this level of delay. All right. So I slouch, it knows I'm slouching. If I straighten up, it straightens up. If I sit, track sitting. As I straighten up, it knows it. When I'm in nice posture, it's happy and green. As I slouch, it slouches. As I slouch forward, it knows that as well. We're also able to track your posture score. So green is how much I've been good, orange is slouched. We track data by days, weeks, months. Your sit time, how much you've been sitting. The reason why sitting is important is it's now known as the new smoking. Even if you exercise every day, if you sit for prolonged periods of time, you're shaving years off of your life. We also track how many times you stand up. If you have to sit all day long for work, simply standing up makes a big difference. Like all the other activity trackers, we can do steps, calories, and mileage. And we also track sleep, as well as your sleeping positions. Now, just to show you where the technology is going, I'm going to do some yoga poses for you. Now, this isn't commercially viable yet, but just to show you where the technology is heading, I'm going to put my microphone down, and I'm going to do a plank, and then a cobra, and then a downward dog.
Thank you, Monisha.
Thank you. Thank you very much. And so it's exciting to be in wearable tech right now because, as we say in our tagline, we're giving the body a voice. And through smart sensors and software, we have the ability to be able to quantify your body's movements for a variety of applications in that it affects your health, your well-being, your injuries, you're preventing injuries, performance. So it's an exciting time to be in this space. Thanks.
Thank you, Monisha. Great. So now I'd like to kick off the panel discussion a little bit. One of the things that I'd like to talk about is more about what are the key challenges that needs to be overcome in the space, right? Obviously, people are accumulating a huge amount of data, and some people are afraid, there's privacy issues, right? Where is the data coming? Where is it saved? Is it being shared by some third-party companies, advertisers, right? Another issue is, the lack of intelligence in those devices. So, in your opinion, I'm going to go, one by one, but maybe you can start with you. What do you think are the major challenges that needs to be overcome in this space?
So, in terms of challenges, I can speak to definitely the data side. There's privacy issues. There's things that we have to be mindful of. Probably Jesse can even speak more to the medical side, but. In terms of manufacturing and operations and building these devices, there's very strict regulations around a consumer product versus a pure medical device, and where you make this product and the partners you work with are quite important. So as we grow forward, as this industry continues to get larger and larger, we're going to have to make sure that the supply base is trained and able to manufacture these products.
Right, now that makes sense. And Jason, what about you from your perspective? I mean, you have a bracelet called the Rain, which has some really good reviews at CES. And that's what I kind of call the wearable 1.5, 2.0 type bracelet, because you guys can actually start giving you insights. It's going to tell a user you need to exercise or you need to sleep, 3 or 4 more hours during the day or something like that. So what are the challenges that you guys need to overcome?
Well, at Jaybird, we kind of really see the challenges is just in this wearable field that people aren't really getting a true value that means something to themselves. And so our Go Zone was an attempt at solving this problem of adding real value to someone, to your own needs. I mean, 10,000 steps is different for everyone. Between me and my father, it's night and day. And so what does 10,000 steps mean to you? And so that's where the real challenge we see in the marketplace, and that's what we try to address with our Go Zone.
Great. Well, thank you. And Monisha, from your perspective, what are the challenges? I mean, when you talk about diagnostic, right, you need to get FDA approval, which is another issue. What do you think are the major challenges in the space?
I think the major challenge is getting wearable tech to be wearable. And what I mean by that is integrating it into people's everyday lives so it just becomes a part of habit, a part of how they do things. It's not this extra thing that they need to do. And I think that's what's going to really make any one of us more successful.
Mm-hmm. And that's why you're seeing some big companies like Intel partnering with Open Ceremony, some of those fashion companies, because it needs to be more fashionable, right?
That's right. That's why we took this approach with Lumo Lift. We see it as closing the gap where technology meets fashion, because it is a customizable clasp that suits a variety of fashion tastes. It's very easy to put on, and it's just far more appealing. Wearable tech has to be a combination of both form and function. It has to do the job it was hired to do, and it has to be very appealing from a design standpoint.
Right, and that makes sense. And so thank you. So Casper, from your perspective, from the VC perspective, I mean, you invested in Basis and Misfit Wearables, 2 leading activity tracker vendors. When you're talking to the startups that are trying to get money and they're going through some challenges, what are the main challenges that you're seeing right now?
Yeah, so thanks for asking. So I work for Norwest Venture Partners. We've been very active in the digital health space, and I would say we've done the consumer side, which is really Basis and Misfit. We also have an investment in a company called iRhythm, which has really taken a medical approach to looking at atrial fibrillation and diagnosis with a nice wearable patch that you wear for 2 weeks. I'd say that the sort of just a generalization that I typically look for is if you take the friction or the amount of effort you have to put into getting data on the y-axis and the value of the data on the other axis, there's sort of a line there where the more effort it takes, the more valuable it has to be. And so I would say when I think about this from a medical perspective, I always ask the question of so what? Who cares? And what does it change? What's somebody going to do about this? And when you get into that loop, you immediately go to what will the FDA think about this, and how do I validate that I've got a diagnostic or I can make a claim, just as you would with a drug or a medical device. What the FDA doesn't regulate is things like vitamins and food supplements. And that's a little bit more like how I think about the consumer side, which is I'm not making real specific claims. But then the question becomes engagement. And how long does that consumer really stay hooked? And little things like battery changes can actually completely kill the product, if I have to recharge every couple days. So, and I guess I would say aside from the friction, which Manisha's talked about, and Misfit is really addressed with kind of going after fashion, what other things drive engagement? Your friends, people you care about, gamification, those are the sorts of things that can drive usage. The other one is value of the data. So the example we have with Basis was, it's not particularly attractive. I'll be the first to say that. It's a little hassle with my shirt. But it's incredibly useful to see my sleep patterns, which is a recent thing. And my personal experience has been I'm absolutely obsessed with that now. I want to see how much deep sleep, how much REM sleep I've had. And I can get that pretty frictionlessly because I just wear the watch at night.
Yeah, so. That makes sense. Well, thank you. And then, JC, from your perspective, you guys have a smart T-shirt, and you can monitor the heart rate. I think you can give someone maybe a stress score, a Zen score, and what are the challenges that you're seeing right now? I mean, fashion, right? Fashion is a big thing for you guys, right?
So, and that's one of the things that's really been a challenge for us, is to make sure that the shirt is something somebody could wear 24/7, and that meant having 4 different shirts. The one I'm wearing, which is a lifestyle shirt, which is going to be underneath, unobtrusive. I can wear it if I get at an event like this. I can wear it in surgery. I can wear it at home with my family, and something that you could wear for working out, because I wear this to work out, but I'd rather have a short sleeve or a no sleeve shirt to work out at the gym. And so that's the kind of fashion side that we've gone for. I think the industry as a whole, if you look at the actual gaining those insights that we're all talking about, it's actually going to be a big culture change for medicine particularly, because really we're sickness and we're disease and diagnosis oriented right now. But I think that where this industry is going is to more goals and people's health goals and people's fitness goals, performance goals. And I think that is going to involve a huge culture change in the way that we see ourselves and our bodies, and the way that we train them, the way that we try to make them better when they're sick. And so from a doctor's perspective, that's the one thing that I think we really have to push, is the idea of helping people achieve their goals and showing them that they are achieving their goals through like really good metrics.
So thank you. So while we're still with you, can you maybe talk about what do you think are the main drivers for wearable health? And I can give you maybe my perspective. When you talk about the need for better insights, right? So today we actually have a startup from Russia called Gizworld, and what they're doing is they take the raw data, steps and calories, and they build an algorithm, right? And they leverage the accelerometer. There is no sensors. And they can diagnose a Fitbit user or Jawbone user with early stage of depression, diabetes, Parkinson, I think diabetes up to 90% accuracy. So imagine if you're wearing a device for 1 month and you can actually get diagnosed at a very early stage. I mean, that's quite powerful, right? Yeah. So that's to me, I see the need for better insights, because when I went at CES, I was just amazed to see that all those devices, they were just doing the same things, tracking steps and calories, but they were not really, maybe you guys are kind of pushing the envelope a little bit, but I was just hoping to see more, right? To see more of those types of solutions from Giro, but it looks like the market hasn't been ready. I mean, it's going to happen, right? Otherwise, people are going to they're just going to stop using those devices. It's already happening, right? It's no secret. So that's one driver, right? The need for better insight. The other one is the need for people to take better care of themselves and better understand their body and their health. So that's where wearable devices can really help. And then, of course, you can imagine a future where you could have a company partnering with an insurance company, and then I would bring my device, at work, and then maybe I can get a discount on my medical insurance every month for being more active, right? So what is your take on what are the main drivers for wearable health?
It's interesting, having worn an up bracelet for a long time now, a year. I think that one of the main things is actually the visibility of it. I think that there was a certain amount of craving in people who were involved in social networks that were virtual to actually be face-to-face with the people that they were friends with. And when you're wearing a bracelet, then you actually see that somebody else is wearing one. And even if it's not the same kind that you have, you really want to talk to that person. I ended up showing some guy on a flight my sleep patterns, and we're comparing our sleep patterns. And I'd never met the guy before. And I think that that's something that is a bit lost in all of this. And it's something that we struggle with because we're underneath, and we've had to think about how we're going to actually build that sort of community aspect and try to actually have people able to find that community of quantified selfers.
Yeah, well, thank you. So Casper, from your perspective, what do you think are the big drivers? I mean, something I haven't talked about is helping reduce the cost of healthcare, which is a big thing. I'm from France, and for me, it's like, it's a nightmare to be in the U.S., honestly, because it's so expensive. But so from your perspective, what are the big drivers for wireless health in general?
Yeah, I'd say the wearable health thing, I always really caution people that are outside the healthcare environment to think that it's a simple thing. It's very complicated because all the incentives are so perverse. You as a user are not the person who typically pays for your healthcare. I mean, you do in a very roundabout way. And you've also got the issue of, for example, of Giro. I haven't met the company, but if you're going to diagnose Alzheimer's, somebody's got a serious opinion about that because you made the wrong diagnosis. That's a big problem, right? So that always has taken a lot of time and a lot of money. So I would agree with Jesse that basically I think it's really going to be driven through consumers wearing these things, and as sensors get cheaper, the volumes go up, they drive down the cost again, much like we see with cell phones. I think we're going to have sensors all over the place. I doubt whether they're going to be implantable. I think that's a whole different set of issues. But I also think we're going to get a need to get to a place where it's not just data for data's sake, but I'm actually doing, I think there's ultimately what's driving it right now is social, kind of quantified self, maybe coaching, sort of things, little things. I mean, what made Fitbit successful was I didn't have to keep a diary. I mean, that's a small little incremental improvement, right? But ultimately, the place we need to get to is to have a more holistic view of the individual. So my We Things scale, how does that correlate with my activity? How does my activity correlate with my sleep? And ultimately, how do those things give me a sense of my overall fitness? So I think ultimately we're going to have to go to networks and some kind of aggregation that sits on top of a lot of individual sensors.
Right. So Manisha, you want to answer that?
I think a key driver for this space is this desire for self-empowerment. And the fact that we can get resolution into our bodies and our behaviors and our health outcomes makes it pretty exciting, right? I think things have shifted from, it's that whole consumerization of healthcare, where it used to be that you go to see your doctor to attend to your health, to now it's a daily thing that you can be in the driver's seat for. And because these sensors give you visibility into your body, into your wellness, into your well-being, and the good ones take that data and turn it into insights and into actionable feedback that are relevant for you based on your goals and based on your progress trajectory. I think it's very exciting. But I think another driver as well on the non-consumer side is this desire to control costs, right? I mean, it's well known. Our healthcare costs have spun out of control. And so whether it's empowering patients to take better care of their health, or using these devices as a way to drive down healthcare costs. So you could imagine using these devices to track patients when they've been released from the hospital. Hospitals now get penalized if you are readmitted within 30 days of being discharged from a hospital. Well, if these wearable technologies can be used to monitor the patient, and if through predictive analysis there's a way to know that somebody is at risk for being readmitted into the hospital, and there's a much cheaper intervention that could happen before that person comes back, that's another great use of this technology.
Right, and so Jason, from your perspective, I mean, you guys have obviously what I call the wearable 1.5 bracelet. And what is the reception from the end user so far? I mean, are they, as opposed to some other devices, I mean, are they really receptive to that? Or
can you repeat that? Sorry.
So, I mean, we talk about the drivers, and one of the drivers is to provide better insights, right? And you guys are, in a way, kind of, I wouldn't say leading the way, but you're kind of pushing the envelopes a little bit. So, are people being receptive so far to having better insights through your device?
Well, from where we stand right now, I would have to agree with that, yes.
Yeah.
Even though we haven't officially launched to market, not until May. But everyone that has played with it has loved the fact that it gives that level of insight. But along with everyone else, the drivers, the healthcare cost is one of them. But the other one that we're starting to notice coming up is insurance providers, such as life insurance and AAA and so forth. They're starting to go from group risk analysis to individual risk analysis. And that's going to be a real big driver, not only in your car, because we're seeing with progressive and stuff like that, it'll come to the human body, and they'll look to assess you in a different light. Because as for my own personal experience, I'm a healthy, very healthy 35-year-old man, and I'm still puzzled why I pay more than an unhealthy 25-year-old when I'm clearly going to outlive them, and it costs a lot less. So those are kind of the key drivers that we're seeing.
Right, thank you. And then, Siupesh, from your perspective, what do you think are the big drivers for wearable health?
Yeah, so definitely the key drivers are related to kind of our reimbursement model, cost of healthcare, especially here in the United States. Like the rest of the panelists have said, there is an incentive to kind of take control of your own health, and obviously preventative medicine and driving down costs. So all those things are in play. For our company in particular with Breathometer, you could imagine we're a mobile breathalyzer, so easily we could have integration with a car. We could use that example with the insurance companies where, through our device we could predict and control costs for the insurance companies. In addition to that, I would just add just another thought is design. So design is also very important in terms of getting adoption and driving growth in the wearable industry.
Right. So I'm going to continue with you. What I'd like to talk about is by 2020, where do you see the future of wearable health? Are people going to be using those connected contact lenses, like what Google is building right now? Are people going to be ingesting pills that tells you 2 weeks from now you're going to get sick or you're going to get a heart attack? I mean, there are some people researchers in the U.S. that are building microsensors that get into your bloodstream and essentially can tell you, 2 weeks from now you're going to get a stroke or you're going to get sick, right? Or are we going to see sensors in all the cars and it's going to know that you're getting tired or you need to get out of the car? I mean, where are we heading, in your opinion?
Yeah, so in my opinion, we're definitely heading in that direction. We can see even the early stages of all that happening now. I believe like the latest Mercedes S-Class has that exact feature, that it will alert you based on kind of your eye movement that you're getting sleepy, you should pull over. So all those things are happening. I think it's just going to obviously go to the next level over time. There's going to be adoption in most likely some kind of transdermal sensing, even ingestibles. But it may not reach mass market, in my opinion, but it's definitely going to go there.
Great, thank you. So Jason, where do you see the future going?
I definitely see us going from wearables to washables, without a doubt, and then environmental. I mean, there'll be multiple sensors in your car that'll help the car know you better. I've worked on various projects in my career with that, because they know everything that the car does, but they don't know how you react with the car. So they definitely want to bridge that gap between technology and the computer and the human. So we'll definitely see those as well.
And you worked for NeuroSky, I think, before,
Yeah,
right?
that's correct. I worked at NeuroSky.
So Manisha, where do you see the future of wearable health?
I see wearable technology becoming more invisible, integrated into our day-to-day lives, whether it's your contact lenses or your jewelry or your clothing, anything that is just already a part of your life. I see those things becoming smarter, and to be able to take data across not only those things you wear, but also elements of your environment, and to create a more holistic picture of the person. So that it's, the code is already there, right? The code is on our bodies, it's in our environments, and now it's a matter of being able to read that code and make meaning out of it.
Thank you. So Jasper.
So I guess I would say, what I was saying earlier, which is I think sensors are going to become ubiquitous. I also think that ambient sensing is a big deal. So we, for example, have seen a lot of companies in nursing home. How can I live independently without having to go to a nursing home? And I can look at your fridge, I can look at the toilet seat, I can look at a scale, look at my medicine closet, all kinds of things. I think we're still in this environment where we're going to be primarily transdermal or external to the body. So I think being able to sense things inside the body is going to be a long way off, just from a regulatory perspective. I would say it's still, we're here in Silicon Valley, a very particular subset of society, and I encourage people to think very carefully about what motivates us is not what motivates, all of America. And so when you think about empowerment and behavior change, I think the vast majority of people in the U.S. need a lot of help to understand what the data means and how to change behavior and make sense of stuff. So I also think it has to become more intelligent and more proscriptive, I would say. So those are the kinds of things we're looking for, because that in the long run drives engagement and really builds a long-term business, as opposed to I'm just cranking out more sensors at a lower and lower price, because as you can tell, accelerometers, I don't know how many there were at CES, at least 100. So I love what Manisha is doing in terms of, a posture, a very specific problem. And I would say for the next 5 years, make sure that you've got a specific problem that you're addressing, and don't just think I'm going to throw it out there and people will come. So I guess my view for where is it going, many more sensors, but you're going to have much more intelligent assisting and sort of ambient, holistic view of what that individual's doing. And I think, Julian, you were the one maybe who said, think of Google Now, which is, hey, it knows I'm on my way to work at 8 o'clock in the morning, so here's the traffic pattern. I think we're going to have the same thing on sensing.
Thank you, Casper. Jesse, what is your take on that?
Well, the way I look at it right now, the sort of healthcare world and just health in general is thought of as more of like an episodic thing, like I'm sick or I'm injured. And if you think about it, it's kind of like air traffic control with people who only know where the plane is when it's on the ground, and once it takes off, they have no clue where it is. That's kind of the model of my practice right now. I see people when they're in pain or when I've treated them. I don't see them any other time. It's not when it's convenient for them. And where I see it going in 20 years is actually having an idea of where the plane is when it's in the air, and actually being able to tell, like, both the user or the person, as well as somebody who's taking care of them, somebody who's training them, maybe their loved one, all having an idea where that plane is when it's in the air. Right. And that's why I work for Home Signal.
Mm-hmm. Yeah. So actually, I'd like to ask you one last question. We haven't talked about that earlier, but I mean, in the wearable health space, you've got different segments, right? You've got activity trackers, you've got smart T-shirts, smart footwear. You can potentially use it on a connected car, smartphone. Out of all those different markets, which one do you think has the biggest potential in the future by 2020? If you could just, prioritize or rank them, in your opinion. I mean, smartphone, for instance, we haven't talked about that, but you have applications today where you can track steps and calories. You can actually put some analytics on top of it, right? So you can predict, Alzheimer and Parkinson just by using the accelerometer. And that's a $1 billion market, right? Last year, 1 billion devices, smartphone got shipped, right? So maybe we can start with you, Jesse. Which market do you think? I mean, obviously, smart clothing, it's a huge market, right? Clothing in general, huge market. So which one, what are the top 3 market that you can identify?
So for sure, like I'm obviously biased in this. Right. It's pretty hard not to say clothing are going to be a big thing, but our thesis is that, since the beginning of time, people have been looking for things to put on themselves, depending on what you believe, since the time of Adam and Eve or like since caveman. And so we don't think they're going to stop. And, the idea there is that if we integrate sensors in a way that's unobtrusive, that you don't notice, then that's going to be a huge market. Activity trackers, I think they're obviously pedometers have been around forever and they had a certain market, but I don't know. Eventually, we're gonna hit the limit of people who are interested in those. I think actually the big data side of things and being able to analyze it, having the algorithms, having that proprietary knowledge is going to be hugely valuable.
Right.
And the question is whether the companies who acquire the data are going to be the companies that hold the data. Mm-hmm. That's a big interest of my own. I'm just interested in who's going to own this data, who's going to care for it. Our users going to be able to trust the companies as much as they trust their doctor, which is pretty much what you would expect, or trust a hospital to keep your data.
Yep, that makes sense.
So those are the 2 big ones I see, and I think like you can look at the way that Nest has had great success, and you wonder about houses and cars and those sort of things, and if they are actually attached to a person. I think that market's going to be interesting as it develops. It's not quite there, but
yeah, makes sense. So Casper, if you have your crystal
it's a hard
ball,
one.
Yeah,
that's what I get paid to do, but it's hard to do. I still think it's going to be. I don't think there's going to be any one dominant market. Honestly, I think this is going to be incredibly fragmented by specific kinds of uses. I think ultimately there is going to be some data aggregation play. Everybody's tracking exactly what you're doing in your browser, and I think this will just be another set of inputs that'll be that much more valuable and that much more interesting if you can say, hey, for example, what was your mood like when you were on a particular website? How much did you exercise? How much were you at work? I mean, I can track how much you've been working or how long you've been working and maybe what kind of stress you've had based on the activities of the day. So I'd say there's going to be an explosion of wearable stuff still for the next 5 to 10 years. And, by 2020, I think hopefully we'll start to see people starting to pull those data streams back in. And I think the really big companies are the ones that make sense of the data as opposed to the ones that, generate devices.
Well, thank you.
Well, I share Jesse's viewpoint, and I'm not biased. I do think that apparel there's a lot of room for innovation there. I mean, once we get over the washability challenge and the cost challenge, and I know we will, it's going to go. The technology is getting there. It's getting cheaper and cheaper, more durable and smaller. There will be a day where, you can choose between a regular shirt and a smart shirt, and that smart shirt will be fortified with all of these capabilities. And there's just so much there, potential there, that if I had to put a bet in terms of where the most innovation in wearable tech is going to happen, it's going to be in apparel.
Okay, great.
I have to agree with Casper, though. It really doesn't matter which market. It's all going to be about data. As he mentioned, Google Now is kind of the forerunner, and it's only a matter of time before health and wellness kind of get integrated to that kind of proactiveness. That's what the Jaybird Go Zone is really doing. It's a proactive measurement, and we're going to see a lot more of that. It's the best way to add value. It's the one that people are really seeking. How we extract the data is a different conversation, but ultimately, at the end of the day, the value in 2020 will come from what we do with the data.
Thank you. So, Silpesh, what do you think?
So, just to add maybe more of a hardware point of view, my opinion is that there will be an integration of smartphones plus sensors where the activity tracking may become integrated into one device, especially by 2020. I think that obviously the key players that are out there see that, and with technology advances and hardware, there should be ways to create some integration.
Right. Well, thank you. So now I think it's time for Q&A. So we're about 15, 20 minutes. So I think we should have a mic in the audience. So whoever wants to ask a question can raise your hand. Well, you should have some questions. Here you go. Yeah. Okay. Go ahead.
So I do have a question. I guess where's the market going? Again, I think somebody said that smartphone and wearables will integrate. Today I leave my house and all I carry with me is my smartphone. I cannot leave my house without that. So I think in the future we won't be carrying a phone, we'll be probably wearing it. And does anybody think it's moving in that direction? What needs to be done in order to move in that direction?
Thank you. So who wants to take that? Jesse or Casper? Or?
Well, I think there's going to be an event here in very soon about like a glass event, right? And that's more what you're talking about, like in terms of being able to visually see something in terms of wearables. And like I think a lot of us represent the collection of the data, not the presentation of the data necessarily. And that's an interesting division. That I think a lot of companies are probably gonna realize that are you a hardware company or are you an app company or are you both? And that's going to be something that is going to develop over time. So your thought of the future is both. The companies are going to be hardware and they're going to present things to people as well. And so I'm curious to see how that develops with companies like Giro actually going and taking the data and presenting it. Not collecting it, but presenting it. So I'd be interested to hear if anybody else, where everybody else thinks that's going to go.
Gosh, when you think about wearables, it's sort of like, how are you going to answer the phone and things like that? I mean, unless you think about maybe this one, the classic one. But I do think, that everybody has trade-offs. It depends where the sensors are. You're not going to be able to pick up what LumoBack does on a cell phone, and there's just no way. Or maybe there's a top secret program, but it depends where the sensors are located. And in fact, that environment is moving very quickly. So, I think, for example, putting an accelerometer on your shoe, maybe that was helpful, but in today's environment with GPS tracking on your phone, you might as well just do GPS. I mean, that's just unnecessary work, right? And so the way I think about wearables is it's yet another way to make things frictionless. If I have to start moving things around, that introduces friction. If I have to charge things, so those are just as important. I mean, if you've got a wearable shirt that you have to charge or tack things onto, just think about the steps of that. And all those little things make a huge difference, I think, in terms of engagement. So I think it's critical that this is either something you want to wear because you're proud of it or it's beautiful, or it's something that you just forget about. And you kind of get these insights at a time when you weren't expecting. It's like a bonus. Here's the insight, you know. But I'm not going to spend a lot of time collecting data because I don't know how many people keep diaries, but it ain't a big number, I don't think.
Thank you. So Monisha, you want to answer that?
Sure. I mean, Jesse, I just thought you had a great answer. Just this idea of separating collection of data to presentation of data, and certainly with Google Glass, it could function as the phone and the display of data, and it would probably still rely on other sensors for collection of data beyond what a phone can do.
Yeah. So Jason?
Yeah. First of all, thank you for your question. One of the problems, though, that we're all experiencing is energy management. The batteries just don't carry enough juice, or the phones are drawing too much juice, one of the two. So those have to kind of find a ubiquity and kind of meet up somewhere. Energy harvesting is now starting to come into play. Companies are looking at that. So once those are kind of sorted out, then we'll definitely see much more integration to where you're wearing your phone and so forth. But until then, it's going to be on hold.
Thank you. Supesh?
Yeah, absolutely. I couldn't agree more, being in hardware. But yeah, it is energy management, and to Monisha's point as well, it's probably a central device with some sensors that are obviously networked with like some sort of central device. But yeah, at the end of the day, you would leave your home with your one device, and ideally the other sensors are transparent. You don't really even think about them.
Right. Well, thank you. So I think we had another question. I'm sorry. Yeah, if you can just pass the mic, that'd be great.
Most of all these wearables are individual items, so the data that gets collected is an individual data. I'm kind of thinking about what is the social implication of collecting those individual data. At least a logical conclusion brought up at one of the...
Can you speak up? It's hard for us to...
Okay. The logical conclusion that one of the panelists brought up was moving from group-based health insurance risk assessment to individual-based. I think at least currently it is an illegal practice. I'm wondering, what is your view of that? Where is that heading? Can you shed some light on that?
Who wants to go first?
Well, it is illegal. It's effectively, you're prohibited from doing that with respect to health insurance. But I think with respect to life insurance or other kinds of risk insurance, you probably are allowed to do that. They're allowed to look at your obesity, your nicotine, cocaine use, drugs of abuse. Those all put you in a high risk category, and they're completely entitled to do blood testing or saliva-based testing to do that. So, I don't know if I don't think it's going to be personally that important. I mean, there are lots of companies that have come to us and we'll stratify risk for people. I don't know that insurance companies are willing to pay for that quite yet. I certainly don't think they're willing to pay yet for changing behavior. If anything, it's like a Fitbit user tends to be more healthy because they bought a Fitbit. I don't know that they necessarily are a lower risk premium, or that because they bought a Fitbit they're going to be in better shape. I don't think that's the bet they're making.
Thank you.
What is interesting about data is if people perceive value in that exchange, it's amazing how much they are willing to give up data, right? So you think about how much data we give up on Facebook and Google, and it's because of this perceived value that we get in exchange. And I could see that happening with our own health data as well, where, if we do get lower premiums on our healthcare or discounts, or other forms of value, I think people will be more and more willing to give up their data. But I think it does have to be on an individual basis. You should have control over your data.
Yeah, and I have to agree with that about the control of the data. But the example that we keep bringing up is Google Now. Google Now has a feature within your calendar. If you have an address on your calendar, it'll take your current location and tell you when to leave. And I grew up in the Bay Area. I learned how to drive a stick shift on the Dunbar Bridge commute during the boom, and that is a godsend to me. I mean, that was a religious experience when it happened. It is the greatest thing ever. So, but I gave that data up, but I got a lot of value out of it, and that's an individual. That's something that consumers and companies are going to have to basically sort out in the marketplace. What kind of value are you getting here? So.
Thank you, Silpesh.
Yeah, I would add that along with kind of the value of the data that somebody's getting back, it's also probably a key thing to understand that as wearable companies, you also have to be very mindful of the data you're collecting. In particular, if you are kind of transcending into the medical kind of world, which is certain diagnoses or certain types of data. So, I would say that it's also very key to understand the implications of collecting your data and keeping it secure.
Yeah, that makes sense. So do we have any other questions in the audience? Okay. Or maybe the gentleman over there. I'm going to give the mic.
Thank you. So as integration or the contextual triggers that you can see in wearable data, it becomes more pronounced, how do you see that integrating into the smart home? For example, you wake up in the morning and your coffee pot turns on because it knows you woke up and it knows you probably want coffee. Or you get sick and your humidifier turns on because it says, hey, you've got a sore throat, it's scratchy, so I should definitely change the humidity here. How do you see this level of data adding more value to the smart home?
I mean, I would love it if I knew my calories in, was equal to my calories out, right? Can I really have that big, piece of chocolate cake at the end of the day? And to be able to know, did I earn it today? Did I work hard enough to earn it? Right? So I think that's an example of, based on what's in my fridge and, what I choose to take out, maybe it's a way to sort of correlate my behavioral data with, what's in my environment.
Or even, I think about getting in my car and whatever, it's an older car, but it still has something where I can press a button and it goes to the right setting for me, where the mirrors and everything go to the right spot. And what if the home could sense the way you are right now and actually just set up an environment that's right for that, for your sleep, for your comfort while you're doing something. That's maybe what I could see happening, that it actually can sense the way you are right now and what you need in terms of environment.
Yeah, I would just add that it's a great thought. Like if then the app that's currently software that you could do for hardware, it's all going to be possible. I think another interesting thing that may not be wearable but is similar is you could potentially take a set of readings at home and then be able to communicate that with your doctor, right, and then get a diagnosis without having to make that trip out. Obviously, there's already companies out there that are either doing that or soon to start that. So those are also very interesting opportunities.
I have nothing really else to add. Everyone's covered my points.
Right. Well, I think personally, when you talk about that predictive solutions, contextual. I mean, if you look at what Google, they bought Nest, right? And we all know Nest. They've got some very advanced algorithm, and those guys have been building devices. And Google is going to have a contextual OS, I think, by 2015, right? So if you put all the pieces together, it's a no-brainer that those guys are going to be driving the market, right? So. So do we have any other questions? I think, okay. So maybe lady in the back. Yeah, here you go.
Do you see in the future the FDA is going to still control, or do you think it's going to be the industry controlling what goes on for digital health?
That's a good question. Well, I think that, if you're going to diagnose a disease, the FDA is going to be involved. And that it's an agency that's there for public safety, public protection, and it goes. I had the personal experience of working on a saliva-based assay for HIV, and you can imagine what the issues are around giving someone. If you're 99.9% accurate, 1,000 people, and you give someone the wrong diagnosis, that's catastrophic for that person potentially. So that's kind of the standard that I hold up, and I think that's the FDA's. Certainly tiering, I can't speak for them, but I think the way they're looking at wearable health is, look, I can give someone heart rate, I can give them breathing information, I can give them activity monitoring, but I'm not going to let you, for example, diagnose atrial fibrillation unless you've done a clinical study and have done all the work to prove that you're as good as either a physician or a trained professional. And there's some room in between, which the FDA, I don't want to go on too long, but at iRhythm, for example, it's a patch that collects 2 weeks worth of data. A computer looks at 2 weeks worth of heartbeats, which a human being couldn't do, and pulls out the suspicious areas. But then you still have a cardiac technician who makes the diagnosis, and the FDA is comfortable with that because that's human intervention. But to make that purely algorithmic, I think would be extremely difficult. So I guess that's kind of how we draw the line. I think it's going to be a while before. I just don't see the FDA on the diagnostic side loosening up there.
I think that the rules are pretty well laid out for devices that are collecting the data. Now, where it's a little different is on the app side. And they've just come out with a draft guideline, which is now, I guess they had it out for a while, and now it's more set in stone. But still, it's kind of a call us policy where if you read their policy and you feel like you're kind of in the middle, then just give us a call and we'll tell you. And I can say from personal experience that I read about one company that it had their product pulled because there was a health risk related to it, not even because it made health claims by Health Canada. And so that's made me pretty leery about any of our marketing material, and I've actually taken the proactive step because of seeing how disastrous that can be, of contacting them and saying, hey, we had this happen. What if this person said something on their blog about our product or something like that, to make sure that it's not going to push us from being a consumer product into something that's a medical product, and so that we don't have to deal with that yet until we're ready for it.
Monisha, you have some thoughts on that?
We have purposely avoided the FDA track because it can really slow things down. We've purposely focused on consumer as a way to grow our business, because you can build quickly, you can put it out there quickly and get feedback and iterate. I mean, in an 18-month span, we put out 3 different products. And we knew that if we had gone sort of the medical route, which requires more FDA approval, it would have just been a slower sales cycle. We eventually do plan to go that route, and that's when we'll get a lot more aggressive with our claims. But for right now, we stay on. We don't ever say we solve back pain. We say posture is related to back pain, and back pain is a big problem, right? But we'll never make that claim that we solve for back pain. So those are the kinds of things you have to be really careful about as you put your product out there.
So, Jason, you want to? I mean, what you're doing is interesting, right? I mean, you're not doing diagnostic, but in a way, you're moving in that direction a little bit.
Right. Ours is still on the consumer side, but it's backed by over 13 years of sports science, white papers, and so forth. So we definitely have covered our where we need to be covered in regard to that. But we definitely try to stay clear of the FDA as well. Though the FDA is providing a framework for all of us to work in, with the line in the sand being diagnostic. And so it actually makes things a little easier because you know where to go, where not to go, and then it gives you a path if you want to move up to the FDA diagnostic side.
Right.
I think it's actually, sorry to interrupt, but I also think that the number of sensors that we have, it's who knows what's going on in the in the bowels of these semiconductor companies, but I think they're limited number of sensors. I thought that Basis was compelling because it had heart rate and you can do ECG, but heart rate's one of the ones that is a huge different dimension than you would get on a cell phone. But for example, blood glucose, I mean, I've seen tens of companies trying to solve that problem, and I think that the FDA will get involved with that. So, for all the speculation about Apple, I don't think they're going to come out with a glucose sensor on their watch.
Mm-hmm. Yeah.
And I would just add that, FDA is definitely here to stay, if you will. Like they're not going to back down and say certain diagnoses are okay and certain ones are not. But to keep in mind, FDA is U.S., right? It is our current market, but there's other regulatory agencies like Jesse mentioned. There's Health Canada, Europe has CE. So there is regulation, obviously. So there's a convergence in that as well. So when you're out there designing your products, you've got to kind of have a strategy, go to market in terms of if you are going to go the regulatory route, which ways make the most sense.
Thank you. So, do we have any other questions? So, gentlemen in the front. Oh, one more. Okay. So maybe, where's the mic? Because I don't see. Yeah, just one more.
I guess I'm curious if there's a risk that you're getting a little cute about the distinction between what's consumer and what's a health device. And it seems like either you or some of your competitors in the wearable space are certainly implying that there are health benefits to these things. So I guess I'm just curious if there is a risk there, if the FDA might come and say, well, actually, even if you're not saying it explicitly in your marketing, you are suggesting it or hinting at it.
I don't think we're doing anything different from what gyms do, right? I don't think gyms come under FDA scrutiny. It's basically saying if you engage in these behaviors, you'll be healthier, you'll be more fit. It's kind of universally understood that if you're more active, you're more fit. So I think, I don't know, I don't really see an issue as long as we're not making claims that are not medically defensible or diagnostics. I don't think we're that different from any other consumer health product or service.
Thank you. So we've got about 4 minutes left, so...
Just to go with that, there's a precedent with heart rate monitors that, Garmin, Polar being probably the trailblazer in all this. So long as we kind of stay within that realm, we're all, everyone's fine. It's, again, when you get to the diagnosis, when you do an AFib or you just had a heart attack, which, the consumer sensors probably aren't as, don't provide enough granularity to even do that.
Makes sense.
I think it's a distinction between providing insight and diagnosis. Providing insight's fine. Particularly if you've got a coach who says, you can journal or you can use, send me the data on your device.
I would just add that, in terms of regulation and FDA, so there are different classifications of devices if you are a device. For example, like a thermometer, right? Like that's giving you a diagnosis. It's your body temperature, but it's not going to be a harmful diagnosis. So there's different classes. Obviously, it's probably not the fact that anybody's dancing around, but it's just it's kind of where you fit in and what you're claiming.
Yeah, I think it's really important that we play around sort of and thread that needle that you're talking about, getting cute around the edge of the FDA, because really this is going to be a consumer-driven revolution. Because doctors are slow to adopt technologies unless they're really expensive and really cool for their practice. If it's something that the consumer's bringing in, they're not going to be as enthralled about it. And I think that we have to push it at them. We have to push it at all of medicine. And that's going to be done by getting it close so that the information that we collect is medical grade, but that the insights we give, that the user experience we give is consumer grade. And that's my bias, and that's the way I think it's going to happen. I don't think it's going to come from medicine prescribing devices to people very often. I think it's going to be the opposite way, and then it will eventually flip.
Thank you. So actually we're going to have to end the panel because we only have less than 2 minutes. So I'd like to thank all the panelists for being here today. And now we're going to start the pitching sessions with all the startups. So thanks again for coming. Thank you. So I'd like to invite Chris Davis, who's the editor at SlashGear. So SlashGear is going to introduce all the 25 startups that we have today. So Chris, welcome for coming.
Thank you for having me.
Thank you. So I will let you introduce the startup then.
Okay, so first up today we have Athos, who's a smart clothing manufacturer taking medical technology and bringing it to the mass market. Okay, sorry. First up, we have Athos, who's a smart clothing manufacturer, and they're going to bring medical technology to the mass market. Okay. And if the people in the demo area could keep it down a bit, that would be fantastic. Thank you.
Thanks for having us today. I'm with Jake Waxenberg. I run branding and marketing for Athos. And as Chris said, we make smart clothing for the fitness and workout space. So we've transformed medical-grade technology that's been used at the top performance performance institutes in the country, in the world, and also at the top medical facilities to track muscle activation, heart rate, and respiratory systems. So what differentiates us from a lot of other activity trackers is we measure direct body signals rather than just simple movements that would happen on an accelerometer. From conceptual phase to where we're at now in manufacturing, we focused on how to provide actionable feedback to the user that the novice could use. This is an old deck. That was a movie that we weren't allowed to play. So, as we said, we don't want to change anyone's habit. So you go to the gym, you work out, you throw your compression gear in the wash. That's the exact same thing that we provide the user. We don't want to force you to do anything differently. There's 14 sensors in our shirts, 8 in our shorts. They measure how much muscle you each use and to its maximum efficiency. So you're able to do your bench press reps at the gym, check your phone and see exactly are you doing the right form and what you need to change. You need to do less weight, more weight, less reps. We also can count cadence on a bike, form within running, and as well as full heart rate from just the shorts. So we're going to have 2 views for our application. A summary view, which says, are you progressing towards your goal and how that's working over time, and an in-workout view, or how are you doing right now and what do you need to do next to improve. And thank you, guys. I don't know if there's any questions.
Thank you very much. So next up, we have Giro, who's a Wearable 2.0 medical platform.
Thank you, Chris. Hi, everyone. My name is Vera. I'm representing a company called Giro. So, we are developing a technology for early-stage diagnostics of chronic conditions as well as the biological age based on the movement activity. Wearable technology obviously is a big trend on the market, and there are many, many devices currently that counts your steps and track the hours that you've slept. But do they know what all this data means? Well, we do. Just from your device, we are able to detect metabolic, neurological, and psychiatric health conditions risks, and also your biological age, which we define as a measure of overall stress response of your body to all the stresses, internal and external, that you encounter. Well, a little bit about how it works. Our body is a complicated system that contains organs and subsystems that are controlled by the brain. When there is something wrong with one of the subsystems, it sends the signal to your brain, which then adjusts the behavior of your body to compensate that stress. So this behavior change is expressed through your motion activity that we then measure and analyze. Here are the figures that we've so far achieved regarding the accuracy of our algorithms, and we're working every day in order to increase those numbers. We've passed the proof of concept phase already. We've conducted a study with the 3,000 Fitbit users last year, and here are the key takeaways from that. First of all, we proved that motion activity does contain signature of chronic diseases. Second, that even the low-resolution activity trackers like Fitbits, Jawbones can be used to monitor those conditions. Number 3, we've shown that we can already diagnose some particular conditions with good accuracy, and we are increasing those numbers every day. And number 4, there are even more interesting features in the motion activity apart from the health conditions. For example, we can tell your gender by the way you move. Here's our roadmap. We are in the middle of our next step study, which is the 50K study that we started in January this year. We started it in order to increase accuracy of our algorithms and get ready for FDA approval that we plan to start end of this year. And we are here today to find partners, strategic partners, to launch together the biological age feature, which can be extremely interesting for insurance and corporate health industries. And we're open to collaborate with activity trackers, smart clothing, and other companies, for example, medical devices, to launch our platform to the market and to discover some new interesting features together. Here's our team. There are 4 co-founders, and altogether there are more than 20 people working with us. That's it. Thank you very much.
Thank you, Vera. So next up we have Plantiga, who is re-engineering footwear for the digital wearable age.
Thank you. How's it going, everybody? My name's Quinn. I am the co-founder and the CEO of Plantiga. Your feet are your foundation, and they play a critical role in your health. They are the bottom of the kinetic chain. They connect us to this earth, and not a lot of people spend enough time recognizing that and building out technologies for that. Footwear literally is the cause of a lot of biomechanical problems for millions and millions of people, whether that is diabetic neuropathy, sprained ankles, slip, slides, or falls. They play a critical part in that. And the problems kind of stem from 2 main issues. One, shoes don't do a really good job of taking shocks from the ground. And 2, when you wear a static shoe, it creates a lot of stress and torque on the body. We've developed a technology called Suspend. Now, this is actually a brand new footwear technology where we have built a suspension system in a shoe. So we have a floating cradle that holds the foot. And that does 3 key things. It creates stabilizing anti-roll properties for the body, as well as has shock release in its core. We also outfitted that floating cradle with sensors. So we actually pick up on the vertical displacement at various points around the foot of that vertical travel of the cradle. So that actually allows us to see what's going on with the foot as it goes through heel down to toe off. We are building out that data and see it moving into places like health, biometrics, analytics, diagnostics, and other areas. Really, we see it as a platform technology. We don't see this as an orthopedic shoe or a fitness shoe, but really we're building it out as a health and wellness shoe. And we are targeting that kind of tech savvy and people that really feel physical pain and or heel pain. We're kind of at that intersection between footwear, casual footwear, and that activity tracking, fitness, mobile monitoring markets. The team right now consists of myself, a mechanical engineer, an electrical engineer, an industrial designer, as well as a spread of advisors that range hardware, software, retail, and retail products. Right now we have a working prototype. We've partnered with some universities and some physiotherapy clinics to run beta trials up there in Vancouver, Canada, where we're based. We've raised $250,000 in seed and government grants, and the technology is patented. We're raising $1.5 million, and that's to see us through expanding the team and bringing the technology up to the point where it can be commercialized. Thank you very much. It's been a pleasure.
Thank you very much. So next up, we've got Vigo, and they have a wearable alertness tracker.
Hey everyone, I'm Jason, the co-founder of Vigo. I know it's going to be a long afternoon with a lot of presentations, and if you're getting a little drowsy in your seats, we built a device that's just for you. So, we all know that drowsiness is a huge problem, but did you know how big of a problem it is? The statistics are actually very alarming. Every year, there's over 100,000 crashes that occur due to drowsiness that result in over 12 billion in damages. It's also been estimated that drowsiness is causing $150 billion lost in productivity at the workplace. What we've built is a solution that's targeting the problem of unintentional drowsiness using wearable devices. So our team started working on this when my co-founder Drew and I were students at the University of Pennsylvania, because we found ourselves getting drowsy during class, and we didn't know how to manage our energy patterns better. That's why we built Vigo, to tackle the problem of drowsiness. So the target market of drowsiness is actually pretty huge. Just looking at drivers alone, surveys show that there's actually been 27 million drivers in the past month who drove while dozing off. Like, think about that, 27 million people driving over the roads asleep. That's actually very startling. And so our primary target is drivers, both casual drivers like you and me, as well as professional drivers such as truck or taxi drivers who have to be driving a lot of hours every day. The secondary market we're targeting is the workplace. So whether that's people who have to be constantly alert all the time for their work, such as security guards, night shift workers, or the average office professional who might get a little drowsy in a boring meeting, for example. What we're building is an ecosystem. We're building the hardware devices, wearable devices that help you stay alert, as well as a software platform that allows you to see this data in real time and see data about yourself. So we've launched our first product, a Bluetooth headset that helps you stay alert, on Kickstarter, and we just raised a successful Kickstarter campaign. We're also looking into other forms, such as glasses or helmets, depending on the markets we're reaching into. The cloud platform allows us to see data about ourselves, and so whether that's information for an insurance company, whether that's information for a security guard company looking at real-time data about their offices, that's where we see the value in that data. And so in terms of our revenue model, we're selling devices and we're selling that data. We're also looking at licensing the technology and integrating Vigo's technology into other forms, such as building it into cars. So Kickstarter has been successful, which proves that there is a market, and we've received very positive feedback from our backers. We're looking into partnerships, both providing it to companies who might be providing Vigo to their employees, for example, trucking companies, security guard companies, as well as looking at licensing the technology. We're talking to car manufacturers right now to see how we could build Vigo into these autos. And essentially, we see Vigo as being part of a technology that can fit around us and help us be alert and be at our best better. Thank you.
Thank you very much. And there will be time, obviously, to talk to all of the startups in the break and afterwards in the meet and greet session. So, I'm a little bit worried about driving home now, I've got to say. Next up, we've got Sculpt, which has developed the world's first fitness wearable to measure muscle fitness.
Good afternoon. My name is Jose. I'm the CEO of Sculpt. And at Sculpt, we're helping people improve their fitness by allowing them to track how much fat they're losing and how much muscle they're gaining in specific parts of their body. So we believe that we still need better ways to track fitness. More than 50 million Americans have gym memberships. Many others exercise outside of the gyms. And we believe that when you track your progress, you stay motivated and you're better able to achieve your goals. However, right now, what people are measuring is their weight or their BMI, which we know aren't great metrics. We know you can have two people who have exactly the same weight, the same BMI, one is in great shape and the other is not. So we know that there's got to be something better. Measuring body fat percentage is the next best thing, but it kind of falls into two categories, the ways of measuring it. One is the type of things that are not very accurate or they're very clunky, like skin fold calipers. And on the other side of the equation, you have things that are just expensive or inconvenient, like hydrostatic weighing and DEXA scans. And importantly, none of these things measure your muscle quality. So if you're lifting weights and you're exercising, you're not seeing how your body's improving in response to that. And that's why we developed the Sculpt AIM. It's the first device on the market that allows you to measure your fat percentage and your muscle quality on practically any major muscle. Then it sends that information through Bluetooth to your cell phone, so you can track your progress. You can get targeted fitness advice. So it's going to give you tailored workouts based on your current level, on your goals, and on how you're changing over time, because it has that much insight into your body. The Sculpt AIM has won the 2014 CES Innovation Award. We were also the winner of the Last Gadget Standing Award at CES out of more than 200 entries. We ran an Indiegogo campaign that resulted in more than 2,700 orders from around the world, resulting in nearly $400,000 in pre-orders. And we're able to find that Our key markets included not just the elite athletes and people who are into marathons and weightlifting and the like, but also people who are interested in fat loss and losing weight. Our leadership, myself, I'm the company's co-founder and CEO. I have a PhD in electrical engineering from MIT with a minor in management from Sloan. My co-founder is a fully tenured professor at Harvard Medical School in the Department of Neurology. He's been developing this technology for more than a decade. It's been widely published, shown to be completely safe. Jerry Panos is our Chief Operating Officer. He's a Harvard Business School alum. He's been doing operations, manufacturing, logistics for more than 20 years. And Juan Jaramillo is our VP of Product. He's leading our marketing and software development efforts. We're happy to give you a demo if you swing by our table later on, and thanks for your attention.
Thank you very much. Okay, I'm told we have a minor technical issue, and so we're going to take a couple of minutes break. So if you stay where you are, that would be great. Or you can move, that's fine too. Get some extra steps in. Sitting down apparently is the new smoking. Or if you'd like to go and smoke, don't do that. No, they're your adults, that's fine. And as I said before, obviously all of the startups talking today that you were going to hear from over the next couple of minutes are going to be demonstrating over in the demo area. So if you want to go and catch up on any of the details there, maybe pick up on some of the things they didn't have a chance to talk about in 3 minutes on stage, that's great. That's why you're all here. That's why they're here. And I know they're all really excited to talk about what they're working on. So, next up on stage, we have Glassy Pro, which are going to be talking about the quantified self for active sports platform for surfers.
Hi everyone, my name is Mikkel and I am the founder and CEO of Glassy Pro, a wearable device created to track your activity and improve your performance in action sports. If you're a runner or a cyclist, I'm sure you use those amazing apps that can monitor everything, such as total distance, total time, calories burned, your circuit, and other things. But what happens with people like me or people who practice other sports, in this case, action sports? We don't have almost nothing like this for this kind of sports. For that reason, we've created Glassy Pro, and it does exactly the same, but adapted for sports such as surfing, snowboarding, skateboarding, skiing, among other sports. As we have started with surfing, I'm going to show you what can you do with Glassy. You can track your surf sessions. That allows you to compete against other users or friends from all over the world, set personal goals, access more than 4,000 spots worldwide, connected to a global weather forecast system, receive alerts for your favorite spots to know when you have good conditions for surfing. And this is the smartwatch called Glassy Pro 1, made up of well-known components, shockproof, waterproof, provides global forecasts for all spots, and it can measure almost everything. For example, the number of waves caught, velocity in each wave, time spent in a wave, total time surfing. It can also recognize the spot where you are surfing, as well as other devices in a 50-meter range to connect with them, share information, create competitions, etc. And users get all of this in real time, equal to amazing results. For that reason, our revenue model is in the sale of premium accounts, hardware and accessories, but hardware is the key line of future business. To do this, we have a strong and well-rounded team made up of more than 10 experts in different areas who come from companies like Google, GMB, Dragon Optical, Factory Media, etc. We also have 4 developers full-time, the support of Plug and Play Tech Center and Plug and Play Spain, and we also have a partnership with Visintech Innova, the engineering team in charge of produce the prototype and future updates. When you realize that there are more than 250 million people participating in action sports worldwide, and that they are spending 6 times more than runners annually, and that the expected sales of smartwatches over the next few years goes from 1 million to 373 million by 2020, you realize that there is an incredible market opportunity for us. If you're not convinced, thinking GoPro. Same market, same strategy, same target. They are doing wearable devices because quantified sales for action sports is unstoppable, scalable, and investable. So if you want to catch the next wave, be part of Glassy Pro. Thank you very much for listening.
Thank you very much. Next up, we have Kronos, which is going to be talking about their full stack for passively collected personal data.
Hi, how's it going? My name is Dylan Kyle, and I'm the co-founder and CEO of Kronos Mobile Technologies. So at Kronos, we're building tools that turn your passively collected data into actionable insights. And the way we do that right now is we have an app that runs in the background and passively captures how you spend your time. All right, so if we go jump to the first slide, what we'll see here is that we're starting this transition from where people used to passively, in the past, manually enter data into their phones. So this is, I'm sitting at a restaurant and spending more time standing across from someone than I am from looking at the phone than I am looking at the person across the table. And we're moving to a scenario, oh, whatever. Does this work? There we go. Anyway, and we're moving to a scenario where we have sensors on our body 24 hours a day, 7 days a week, and that allows us to get a lot of information. The problem with that is the information we're collecting is being collected in these individual silos. And so it's wonderful to know how many steps I'm taking or how much I'm exercising. But if I want to exercise more, I have to do something else less. And right now, we're really not looking at those correlations or the intersections between those different verticals. So what we're trying to do is basically look at the holistic sense of the user. So all 24 hours during the course of the day, pull in data from different data sets, and ultimately understand the user not just in one vertical, but across those verticals. And after we aggregate those data sets, we actually can analyze them and start to understand how these data sets react with one another. So we can see that if you spend more time in the car, that ultimately impacts how much time you have to sleep or how much time you have to spend with your family. And that means that the insights we can provide are much richer and much more towards the source of what we're trying to solve. So what the app does today, you download it, you run it in the background, it sits in your pocket, and we'll show you where you spend your time based on your accelerometer data and your location data. And we can show you how much time you spend sleeping, exercising, commuting, hanging out with specific friends. And then on top of that, we let you set goals. So you can go in there and say, hey, I want to go to bed before midnight. I want to leave the office by 5. I want to make sure that I'm going to the gym every day for 30 minutes. And again, the beauty of this is that there's really no friction. You're not buying a device. You're not charging something on a daily basis they're not charging already. You're just downloading this free app, forgetting about it, and we're getting this holistic picture of you 24 hours a day, 7 days a week. On top of that, we create these shareable infographics that allow you to go out there and take this content and not only reflect on it and make better decisions in the moment, but also share this with your friends and get the motivation that can provide. So I think importantly, we really see this as something that can reach a mainstream audience. While most people are not really interested in knowing where they are in their REM cycle or what exactly their blood glucose levels are, people do want to know directionally, am I making the right decisions today that lead me towards my long-term goals? And so that's where we're focused, saying it's much better to be 80% accurate across all these verticals than being 100% accurate in one very specific vertical. In terms of where the value comes from this, well, we know where you are, what you're doing, when you're there, who you're with, and that provides a lot of information that we can do for valuable lead generation. So we can provide you products, services, experiences that are targeted towards what you're trying to do in terms of your goals, but also targeted towards what third parties might be trying to give you so you can achieve that goal. In terms of our team, there's 3 of us right now, a combination of developer, designer, and we're in the process now of building the next phase of the product. Thank you.
Thank you very much. So, next on stage, we have Velo Computer, who are here to talk about the precision, performance, and power of the bicycle-related technology. Sorry.
Hi, my name is Vlad Savchenko. I'm founder and CEO of Sound of Motion Technologies, the creator of Velo Computer. We do actually create more apps for sports, but I'll be talking about a specific one, which is for cycling sports. A few words about our company. We're actually not a quite usual startup. We've been founded in 2007, and we've been doing a lot of research and development around cycling sensors. One of our major investors is Andy Rees. In case you don't know, he's also co-owner of BMC professional cycling team, as well as BMC cycling group from Switzerland. Just a few words about the market we are dealing with. It's a sports and fitness monitoring market. It's about $2 billion in sales, and it's in 2011 it was supposed to grow at 20% rate. Now we actually see it's about 30%. Now here I'm going to have a demo, quick demo, and we'll see how that works. If it doesn't work, no, it didn't work. There is actually a stand with the bicycle wheel, and I'll show you how that works. But what we actually created is the high-precision magnetless sensor for bicycles. People who actually train, they use traditional sensors which have a magnet on the spokes which actually measures the wheel rotation. We eliminated this magnet whatsoever, and at the same time we achieved what we call 1 degree precision, which can actually measure your distance in increments of 1 inch. And we do offer 3 solutions for different type of riders. Our addressable market goes from 300 million recreational cyclists at $69 product and going up to more seriously dedicated cyclists. Now, we are in the process of raising our next round, and here's our financial forecast. We actually expect that whoever is going to participate in this round will get about 10 times or more return within the next 2 years. And here's our investment opportunity. So now we have already half of the first round committed from our previous investors, so we are looking at about 250 now. And I also put here our next forecast for the next round. So again, demo didn't work, but there is a wheel at the table, so come to me. I'll show you how that works. It's probably better to see than to listen. Thank you.
Thank you very much. And as we heard, obviously there are demonstrations of all of these products in action that you can go and check out and kind of ask any more specific questions. So next up, we have Smart Monitor on the stage, and they'll be talking about their wearable which detects repetitive shaking motions.
Good afternoon. I'm Manu Nathan from Smart Monitor. We provide a platform solution for managing chronic conditions like Alzheimer's, congestive heart failure, hypertension, and more. We believe in taking the crawl, walk, run approach. So we have commercialized our solution for the first chronic disease vertical, epilepsy, and people dealing with seizures. 4% of the population suffers from epilepsy. It is across all age ranges, from infants to the elderly. We are spending about $18 billion in the US alone on treating this condition annually. So the problem with epilepsy is that it involves loss of consciousness, loss of awareness, and the seizing person needs help but is not in a position to summon help. Patients need round-the-clock monitoring, and caregivers need to be on hand to provide assistance. Doctors are using scattered and fragmented data provided by patients in treating this condition. There is not a reliable way to get at the various parameters surrounding a seizure episode that is so critical in treating it. So our solution fuses together wearable technology, sensors, mobile applications, and data analytics. The person prone to seizures wears a smartwatch, which has algorithms to detect seizures, tremors, convulsions, fall, and also activity and sleep. It notifies the smartphone upon an emergent condition. The smartphone jumps up and sends text and phone call alerts to family and care providers, including GPS locations. Data is also seamlessly acquired on a back-end cloud server for later analysis and reporting. Our pricing model is very simple. There's a one-time fixed cost and an ongoing monthly subscription. These are very consumer-friendly price points that have been very well validated. It puts our available market opportunity at about $2 billion a year recurring. We have already launched the product. We are generating revenues. We have been in the market for less than a year. We closed 2013 with less than $200,000 in revenue. With our current run rate, we expect to triple that at least this year. Our team, we have solid experience taking companies from inception to growth and profitability to exit. A good blend of technology, healthcare, and business backgrounds. We are very proud of our accomplishments to date. As I mentioned, we've been in the market for less than a year. We already have 500 plus paying customers and counting. Our product has strong clinical validation at Stanford and UCSF. We are selling internationally. We have a key fundamental patent already granted to us. We have some amazing success stories from our existing user base. I'm happy to share more. It's on our website. We are raising a Series A to scale and grow the business and expand into other verticals. Thank you.
Thank you very much. Now, second to last in session one is Lithouse, and they'll be talking about their Bluetooth hub for home automation.
Good afternoon, everyone. I'm Nahid. I'm the co-founder and CEO at Lighthouse. We are building Bluetooth hub for home automation. So there is a growing number of Bluetooth devices. By 2015, Bluetooth will be the most dominant technology in smart home. And by 2018, there will be more than 132 million smart home devices that will have Bluetooth. So what is the problem? Suppose you enter your home wearing a Fitbit. Wouldn't it be great if Sonos starts playing your favorite music? It doesn't happen now. Your smart bulb, Bluetooth smart bulb, works perfectly well with your smartphone. But what if you are in a vacation and you want to control your bulb remotely to turn that on and off so that people think you are in the home and no one breaks into your house? There is no solution for that either. Our solution, a Bluetooth hub that solves those two problems. We provide you with a hardware platform that you can use to remotely access all your Bluetooth devices and allow them to talk to each other between Bluetooth and non-Bluetooth Wi-Fi devices also. We see there is a growing number of hardware-software platforms in the Internet of Things area. Our focus is in the connected home area. We provide patent-pending technology with Bluetooth that will allow you to remotely access all your Bluetooth devices that no one else provides. Finally, we have a great team of experience with hardware and software in Intel and Amazon. Now I'll walk to the table. And you will see the Bluetooth bulb turns on. I'm wearing a Fitbit, so see it works. It's a bit slow, that's why we need funding. Okay, you can come to the demo. Sorry. Oh, okay.
Thank you very much. The perils of a live demo there. Finally, in session one, we've got Goki, which has developed a fitness-oriented wearable bracelet that brings together the world's leading experts in health, coaches, and karma into a single platform.
Hi, everyone. Good afternoon. My name is Kirti Mehta. I just want to take a quick poll of the audience. How many of you guys have used a personal trainer before? Personal trainer? Yes. How many of you have used the wearable fitness device? I know quite a few of you. How many of you are actually actively using that on a regular basis? So some of you, yes, some of you not. So we are seeing that trend. Personal trainers are fantastic, right? They're there to help you, they encourage you, et cetera, but they're expensive. Wearable device, it's great, it's a great alternative, cost effective, but again, you're gathering all this data, and what we're actually seeing, the trend is that there's really no sustained engagement. There's really missing that motivational piece. And what's really lacking here is that human element. Goki Life actually solves for this. It actually is a Goki Life ecosystem, is what we like to call it. It brings that personal trainer element, the wearable device element all together. How does it work? You sign up for a service, you receive the band. Essentially, it tracks all of your activities, your heart rate, etc. Then that information goes to your Goki coach. You are actually assigned a Goki coach, a real live human being. Yes, this is true. You actually can talk to somebody, text somebody. Monisha, I think you talked about wanting that chocolate cake earlier. Your Goki coach can tell you yes or no based on your activity for the day. What's great is that this coach actually helps you to stay motivated. It interprets your data for you. It's really like your personal cheerleader. And I like to call it your personal lifestyle manager. Because Goki is really more a holistic approach. It's really bridging the mind, the body, the soul. And we believe that it's also very important to give back. And this is where the karma element comes into play. We call it sweat for good, or you're receiving karma points. Sweat equity, if you will. You work hard. You stay active. Every step, every activity is translated to karma points. And then you can in turn turn that karma point and donate it to any nonprofit that we're affiliated with. So with Goki, again, like I said, it's really an overall approach. It's about being the best that you can be, and it's an overall holistic solution. And what we want and what we want to strive for is that everybody can be the best that they can be, and you can be the force. Thank you so much for your attention.
Thank you very much. I'm afraid I misled you. I'm sorry, you should never trust the British. We have one last person in session one. It's Race Yourself, and they've built a fitness gaming company which combines wearables and augmented reality and builds a unified digital fitness platform across multiple different platforms. So they're coming on stage now.
Is the mic on? Perfect. I apologise if my presentation is a little rushed. It's my first time presenting, so if you do bear with me, that'd be great. Can I just have a quick poll, show of hands? Who here uses an app, something like Strava or Runkeeper, to track their fitness? Hands nice and high, please. Okay, so quite a lot of you, yeah. And we very much came up with the same problem. We go running a lot, and it's very repetitive. You can see information by Strava and Runkeeper, and it's awesome. But over time, it does get pretty boring. What happens if you were chased by zombies? And what am I even on about? So basically, we're designing a killer app for Google Glass, where you can actually physically see in real time your own avatar from your previous run, or you can see kind of augmented reality kind of games, like zombies chasing you, for example. You could also run against Usain Bolt. You could actually see how fast Bolt actually is in front of you, and you could maybe measure your 100 meters in number of bolts. So maybe I could do mine in 2.5, or you could do yours in 3, or whatever it is. And you can race against friends. How awesome would it be if I could actually see an avatar of my friend's time in front of me and literally know that I'm going to beat him on my 5K run, rather than getting to the end of my run and going, oh, I missed out by 5 seconds or something. It's all about that real-time feedback. And if anyone's done rowing, they can hopefully definitely agree with me that it's pretty boring. So that would be much more immersive if a great white shark was coming at you. And really the whole company, Race Yourself, is all about self-improvement, how to kind of push yourself to the extra limit. And so this is really who we are. We're a Glass-enabled fitness platform for mobile and smartwatches. We're developing a killer app for Google Glass, but we're also developing one for mobile as well, and for smartwatches. So the idea of the outdoor Wii Sports. These are just some images from the promotional video. Please do go check it out afterwards. It's about a minute long. So you can literally see you being chased by a boulder, zombies, running marathons against friends. We want to move into skiing and skydiving eventually. So the UI, the user interface on Glass we've built is incredibly transformable. It's incredibly immersive, and I'd encourage you to come over and have a demo later. And I'll just rush through the slides quickly. I'm going to make the revenue model through in-app purchases, third-party content. As I said before, it will be on mobile. And Google Glass is constantly evolving. It's coming out with new lenses. It's looking better, slicker all the time. And for sport, we definitely see this as one of the key areas. And moving forward, this is kind of 3 areas that we are hoping to kind of infiltrate with the upsell experience with Google Glass. And the team's incredible. I'll just skip past that. We see ourselves in the top right of that graph. I have a lot of press. And yeah, thank you very much for listening. Cheers.
Thank you very much. And that seems a great place to stop session 1. So you've got about 15 minutes now to go and grab some coffee, get caffeinated, have a chat with some of the startups, and then come back for session 2 when we've got another set of fantastic startups who really want your attention and time. Thanks very much. So, first up in session 2, we have Laster See-Through with their mobile informative eyewear. And this is augmented reality in a headset very much like Google Glass. I think you'll enjoy it.
Hi, everybody. I'm very pleased to be here. My name is Zil Liu, founder and CEO of Laster Technologies. Our company is specialized in augmented reality device, and we develop several technology for augmented reality glasses. So just start by a few minutes background of our company. I don't know why it don't work here. Okay. So Laster Technology was founded in 2005. Our company started by working on aeronautics field by providing head-mounted display and head-up display to pilots. And we developed now new technology for consumers. And we realized $600,000 last year in revenue. And we are looking for $5 million now to open the consumer market. So we developed the Laster See-Through. So this is augmented reality glasses. So I have one on my head, so I can use it, and I can see information around my slide, of course, and I can see you also. Don't worry, because I'm not camera on the glasses. I'm not a glass hole, so you are not filming, so don't worry about that. But the interesting thing is that we can have wireless augmented reality glasses. Compared to Google Glass, we provide 3 times larger field of view. So it's a big screen, and we have an autonomy of 6 hours, and we provide what we call genuine augmented reality. So what it is? So with our glasses, you can see information directly on your natural vision. You don't have to look at the right corner like Google Glass. You see the information directly on your natural vision, as we can see here for medical surgeon application. Same thing here. But there are a lot of applications with our glasses, and mainly in sports. So, for example, here you can see information directly related to the object. Each object is directly overlaid by the glasses. So, imagine when you are also jogging, you will have information. We have a lot of startups here who develops a lot of device. We can couple with this device by Bluetooth and sending all the data to the glasses. So here it's another application with paragliding and for sailing too. So that's it for my presentation. If you want more information, please visit our website or our social media platform. And of course, we have a demo near here, so come on, you're welcome.
Thank you very much. You can just give that to the next person. Thank you. It's gone very quiet. I was just about to tell the people in the demo area to be quiet during the presentation, and they're being quiet. That's brilliant. Next up on stage, we have Vicinity Health, and they're talking about their wearable device which predicts and prevents asthma attacks.
It feels good to take a deep breath, but imagine not being able to breathe. For 300 million people worldwide who suffer from asthma, this is a daily reality. And even worse, 250,000 people die every year from asthma. And 42 days ago, I was almost one of them. On January 19, 2014, I suffered a severe asthma attack that put me in the hospital for several days. And while I laid in my hospital bed, I vowed to find a way to take control of my asthma. Wheezy is a device that plugs in your smartphone that allows you to monitor the way you breathe. It effectively turns a $10,000 spirometer that hospitals use to measure the health of your lungs into a personal handheld monitoring system. Wheezy is able to identify the triggers of your asthma attack by using our hardware and all other wearable devices. Wheezy then calculates the probability of your next asthma attack on a future given date. Wheezy will then alert your doctor, allow them to know, and help you mitigate these attacks. And Wheezy, your doctor is then even to customize a treatment plan to help keep you out of the hospital and even just improve the quality of your daily life. Our mission at Vicinity Health is actually to shift the focus from healthcare to preventive care and also empower the patient the ability to take control of their lives once again. It's been 6 weeks since I launched this company, and we've created a functional prototype, patent pending, Wheezy prototype, and it works. In fact, my doctor has already used my own data to actually change my treatment plan, and I can tell you today I actually feel better because of it. We've actually had patients actually come to us and already want to sign up for early beta testing, and we haven't even launched till today. So I can tell you there's definitely a huge interest in it, and they want to be first in line. Upon funding, what we like to do is we actually would want to create a first test trial for a few hundred patients and collect the data from that and actually validate our technology and our results. Then we would like to submit Wheezy for a fast track 510K FDA certification and have Wheezy as an over-the-counter access solution. We're also working with insurance companies to make sure that's affordable so everybody wants it can cover the cost. We have a huge team. Francine from Intel and Stealth Mode. Myself, I'm a programmer hacker. I do have a CMO, Denise. She's actually one of the best product marketing people I've met over the last few years. And several other people. We actually also have a CEO that we've on board in the next few weeks. I am asking you to join us to help people take control of their lives and put asthmatics' health back in their own hands and just help people feel better. So please, help us help people live life longer. Thank you.
Thank you very much. Next up on stage, we have iHear Medical, and they offer new hearing products, including ones you can use while swimming, and free hearing aids to the economically disadvantaged. Thank you.
Hello. I'm really excited to be here to talk to you about iHear Medical. If you can hear me, please say I hear. Just kidding. All right. I promise it will be the last time I say that. Why concern about hearing loss? Hearing loss is a chronic condition affecting over 40 million Americans. It's also a global problem affecting over 360 million people who suffer from disabling hearing impairment. Hearing loss, as you can imagine, causes a wide range of economic, social, and health issues. What you probably don't know is that although it affects older people to a greater extent, but actually 65% of the people who are hearing impaired are actually under the age of 65. What that means from a digital perspective is that the vast majority of the hearing impaired are actually internet users. So the problem with hearing impairment is ownership is historically low at about 20 to 22%. I've been in the industry for about 24 years, and this is a very persistent statistics. Only 1 out of 5 people who need a hearing device actually own one. Compare that to vision correction. The vast majority, over 95% of the people who need vision correction have eyeglasses or contact lenses or some other surgical approaches. So what is the impact? What would a hearing aid do for an individual? It dramatically increases their earning power. It also enhances their emotional and mental stability, reduces anger, anxiety, and also improves their overall health status. So what are the barriers? Why only 1 out of 5 people have a solution? And there are really 3 major barriers. One is high pricing. People are shocked when they are on the market looking for a hearing device to find that the cost on the average is about $1,700, and most people need 2 of them. Cosmetics is a major issue too. Unfortunately, people associate a visible hearing aid with aging and disability, so people avoid having to deal with something that's going to be visible to others. And also access. Most people don't really know where to go for a hearing solution. So our mission here is to create hearing solutions that are affordable, similar to prescription eyeglasses. I know I'm running out of time. So our product is an invisible hearing device. It's a plug-and-play solution. It's dispensed online by our online tools, and it's also developed by a highly experienced team that has been involved in hearing healthcare for over 2 decades. So our system has really 3 components. It has the hearing aid, which is an invisible form factor, and it has a USB device, and it has online tools. I'm going to go quickly through the very last slide. I apologize for this, but we are basically a startup company that has 18 patents. We have 5 10K applications, and we're looking for, we're doing a round C financing. We're seeking $4 to $7.5 million financing, and we have a term sheet, and we love to find 1 more investors to be able to close the round. Thank you very much, and appreciate the opportunity.
Thank you. And of course, you can go and have a look at iHear Medical and all of the other startups today. They've all got their stands over there. Next up on stage, we have RxMatch, which talks about valuing the patient experience using their software platform.
Hello, everyone. My name is Keon Rizadeh. I've been an orthopedic surgeon for over 10 years, and I've recently left my job to focus on using RxMatch as a tool to help change a very broken healthcare system. So the problem is right now, half of the treatments we use today have known outcomes. A study recently came out comparing the most commonly done knee procedure with a sham surgery and showed that it had equal results. This one procedure leads to over $4 billion of costs a year. So by not knowing the outcomes, this leads to unnecessary procedures. This leads to rising costs and a low patient satisfaction. So at RxMatch, we're really an online and mobile patient community. We're focused on patient-centered outcomes. We really help individualize the treatments that patients see, and this leads to lower costs and an increase in patient satisfaction. So we really have 3 main functions of our site: match, discover, and track. Patients are able to match up with one another in a very meaningful way based on specific patient factors such as age, such as activity level, and also other health factors. And we realize that even though every patient is unique, they're not alone. So as patients can then discover in the Discover tab all the different treatment options for those patients most similar to themselves, they can see the outcomes of many different treatments such as medications, non-operative treatments such as yoga or surgeries. And they can also track their data over time and see which treatments have helped during their recovery progress. We now have a white-labeled solution that allows big healthcare organizations and hospitals to now track the outcomes, because that's what's missing. And then they can get insights into the outcomes for their specific users in their organization. Wearables for us is really the next big step. As we get more data, we're able to get more accurate results and make more valid conclusions. So currently in RxMatch, a patient manually enters data and they're able to track their disease. Now with the wearable data, we're able to get more data with less user effort, and we're able to get it more quickly, and then we can more quickly give recommendations to the patient. So at RxMatch, we're collecting data points for activity, but with wearable, we can with wearable devices, we can collect many more data points. And not only that, we can collect really novel and different data that otherwise we wouldn't be able to collect, such as posture, and make really meaningful conclusions about, back pain. So basically, more data points allows us to make more meaningful conclusions. For example, the wearables such as contact lens or a heart rate monitor, if, for example, a patient has a side effect of dizziness associated with a certain medication that they're tracking, then we have so many data points we can link up whether or not the heart rate is the cause or the glucose levels is the cause, and then we can make meaningful conclusions. So at RxMatch, we're really looking forward to making these strategic partnerships and looking forward to opening the wearable world to our users. Thank you very much.
Thank you very much. Next up on stage, we have Sensorplex, and they develop and manufacture standardized and customized modules for the wearable health, fitness, medical, and industrial market.
Sales for Sensorplex. We're a small startup company. We're based in Redwood City. We're a group of individuals that have a very large experience in sensors, wireless, and computing, which is really the generation of the firmware that goes with it. So we're 100% focused on wearable sensors. That's all we do. We're hardwareans, so we essentially develop the hardware that goes inside of those wearable sensors. You will never ever see, for example, a device, a watch, or anything like that with a Sensorplex name. It's all about developing the hardware and enabling customers to go quicker to market. So as we all know, there's a number of different wearable sensors in the market, starting with clothing, watches, pendants, bracelets, all kinds of new developments. So the market is actually quite large. And as I mentioned, we're experts. Pretty much everybody in the company has a large, very tons of experience in sensing, computing, and wireless. And the market is very large, billion units in 2020. So this this chart right here kind of exemplifies the penetration into the U.S. Starting with the automobile, took to get about to 70%, about 70 years. Then later on the telephone, electricity a little bit quicker, TV very fast, and of course the PC and the smartphones are very large markets. Wearable sensors is a little dot at the bottom, but as I mentioned, the market is very large. So what we do is we empower people, we cut down time to market, and we like to work with people to really develop the products that they need. Our initial platform is a very small device. It's 15 by 40 millimeters. It's FCC and CE approved, and in the 9 months that we've been alive, we already have about 70 customers. So this little platform, customers use it to evaluate the technology, and obviously after they evaluate it, they come back to us and they say, yeah, we like it, but we need to have a little bit another sensor, we need a different form factor. So we typically engage with them to take the next step and develop the products that they actually want. So this small device is optimized for power and performance. So it has a 9-axis device, accel, gyro, compass. It has a pressure sensor, temperature sensor. It has an ultra-low power embedded CPU with all the firmware that goes together with it, and sensor control. In the future, we're also working, this, by the way, is a 16-bit platform. We have a 32-bit platform coming up. And also developing the interfaces to have humidity, oxygen, heart rate, all the biosensors that are, very important in the market nowadays. So the typical design flow is our customers, buy an SDK, they take this module, then they evaluate it. We provide the algorithms, and later on, when they want to do customization, we engage with them. We do the testing, application software, and everything else. Okay. All right. Very quickly, we're hardwareans. We like to work with people to develop their products. And if you have an interest, please come talk to us.
Thank you very much. Next up on stage, we have Nimble Heart, and they provide complete cardio awareness at your fingertips. Keep the microphone good and high.
Hello everyone, I'm Sonal Tambe. I would like to start with the story of someone named David, who is in his early 50s and works for a high-tech startup like ours. David's life has stress and some other things, and that gave him a heart attack. His doctor cured him out of that using angioplasty. But guess what? David's life is not the same anymore. Even the regular activities, like his regular workout, cannot be carried out with the same rigor, and occasionally during a stressful board meeting or during his fitness walk, daily fitness walk, he gets chest cramps, and that gets him worried so much. Should he call 911? Should he go to his doctor? Or should he just live with it and ignore it? Cardiac rehab is not a possibility for David, unfortunately, because it doesn't fit in his schedule and lifestyle. David looked at some other monitoring possibilities that could buy him some peace of mind. An implantable device that can monitor him 24/7, nah, he's not ready to have his heart open again for another surgery. Traditional Holter or event monitor, it can be used only for a limited duration of time. Other ECG products on the market, they do not detect real-time ischemia during his activity like an at-risk individual like him needs. In 2012, Dr. Pramod Deshmukh and I founded Nimble Heart to address the problem for at-risk population like David. Our product is a harness that can be reusable, and it can be used by men and women to detect arrhythmias and ischemia real time. Our multidisciplinary team has come up with a patented technology that can get cardiac data, which is of clinical quality, but in a very consumer-focused way and at an affordable price. The device can alert the user real time if they have arrhythmias or any limits that are preset in terms of heart rate or ST segment changes, which is ischemia, are exceeded, and they're alerted to stop their activity and seek medical attention right away. People like David are definitely happy with our product, and so are other cardiac rehab centers who are willing to try it anytime. We believe not just David, but people world over can benefit from our technology because home-based cardiac rehab is the way to go. We have raised $250K so far and created a prototype that has been validated, and we are looking for $800K more to bring it to the hands of people like David and his doctors. Thank you.
Thank you very much. Next up on stage, we have Infometers, who will be talking about how they're enabling remote patient services.
Hi. So Infometers provides excuse me, I'm a little sick right now. So Infometers provides a platform for remote patient monitoring. Why is this important? Chronic care is 3/4 of the healthcare costs today. And people with diabetes, hypertension, and other conditions are costing us billions and billions of dollars. Yet prevention has been shown to reduce impact, and in reality, every $1 spent on prevention results in $5.5 in return on investment. How come this monitoring that helps is still not really available? Well, even though devices are readily available, gathering data from devices is extremely complicated and laborsome. Currently, the healthcare staff spends a significant part of their time calling up patients, going to their houses, going up to hospital beds to get the data. And the reason why this has not been solved electronically is because there is millions and millions of devices, 10,000 different device types, and based on estimation from West Health, there is over $30 billion of costs in direct interoperability. So our solution provides a standardized system for medical device integration. We download data from multiple medical devices and we put it into the physician's hands. Our platform is a tier platform that could be used in a flexible manner for management of various chronic conditions, and we provide both an interface and the pipe for data download. So far, we have been making some initial sales, and over the last couple of months, we made a few $1,000s. But in the future, we are planning to greatly increase our sales in the next couple of months as well. And we are working with a number of large and small partners. Some of them are healthcare providers, like UCSF. Some of them are medical device companies, like A&D Medical and LifeScan and Embrace, as well as some of the health IT startups that are in the Valley today. Our team is composed of serial entrepreneurs and people with experience working for healthcare companies. Most of our advisors are running healthcare companies themselves or have experience in data integration. We've raised over $100,000 so far, and we used the money to file patents, create an early product, and get validated through our first couple of partners. And now we're looking for $500,000 more to finish our pilots and boost our sales. And thank you.
Thank you very much. Now, next up on stage, we have ChemiSense, and they're going to show us how they're helping people to breathe smarter.
How's it going? So everyone knows air pollution is a problem. We're from ChemiSense, and we're here to help you breathe smarter. Our first product is a wearable air quality device that tracks the air quality around you and alerts you if something is wrong. Our team consists of chemical engineers, physicists, and computer scientists from UC Berkeley, Caltech, and Princeton, and we've spent the last 2 years developing a solution to this problem. So, jumping right into it. There we go. All right. So, the World Health Organization has listed air pollution as a Class 1 carcinogen, in the same ranks as asbestos or even cigarette smoke. Most people don't realize that this leads to over millions of premature deaths every single year. And this, in turn, leads to billions more in medical costs. On top of that, as I'm sure most of you in this room know, activists spent well over $1 billion on the wearable fitness device market last year alone. So we believe that this highlights a big market trend that more people are concerned about their health and their environment, and it's growing exponentially. So this brings us into our device. The current solution for these people is a large, bulky air quality monitor that's done at the municipal level. Our product is a wearable air quality monitor that lets you know anything and everything that you might want to know about your air quality and alerts you via your smartphone if something is wrong. On top of that, we intend to crowdsource the data from all the user points to develop a heat map of air quality that can be seen both in real and historical time, sort of like the Waze for air quality, if you will. So I'm going to jump into our technology briefly. We utilize chemiresistor technology, which are essentially polymers that have been functionalized so certain chemicals can attach themselves to the polymer. When they attach themselves to the polymer swells and changes the resistance of a circuit board that it's been attached to. By putting these circuits into an array, we can create chemical sensors that are far wider in scope than anything that currently exists at a fraction of both the price and the size. So when thinking about going to the market for our device, we decided to target the asthma market, but more specifically, children who are in the management phase of their disease. And this is for two reasons. The first being that our product adds the most value by letting people know what triggers their asthma. But secondly, because parents of children with asthma are emotionally invested in preventing these attacks. And our market research has demonstrated a high willingness to pay for this. So our beachhead market size is $300 million per year alone, just based off of monthly data subscription fees and not the price of our device in itself, with a total asthma market of over $3 billion. So we intend to use our chemi-resistor technology to provide cheap and portable chemical detection to wide ranges of industries. Some of them I have listed to the left and to the right. So this is our team. Feel free to come and talk to us, as well as some of the schools we've gone to. We're currently seeking to raise $1.2 million in Series seed funding, and this will help us bring our product to the market in a 13 to 14 month time horizon. Thanks, everyone.
Thank you. Next on stage we have Lift Labs, and they're going to show us their Liftwear spoon, which helps Parkinson's sufferers control their tremors.
Thank you. My name is Anupam Pathak, and I'm the CEO and founder of Lift Labs. And we're a new technology company that's working on developing new devices and systems to help in the assistive market, as well as monitoring and therapeutics. So today I'm going to talk to you about our first product, which is a Liftwear spoon. And today, when you try to, when you sit down for dinner, I want you to try to imagine what it would be like if you had the tremor that you last time you were threading a needle, amplified to a point where you're actually unable to feed yourself. So this is the reality for millions of people in the US, and actually it's about 1% of the population, and there aren't really much treatment options out there. Drugs help about 50% of the time, but there's a lot of side effects. And as a last resort, people might get brain surgery, but as you can imagine, it's very invasive, and a lot of people are pretty hesitant to get something like that. What people have tried in the past is create these sorts of braces to actually stop a person's hand from moving. And as you can imagine, people aren't going to want to go out in public with that. And what we wanted to do is provide a solution that really comes from a direction of empathy and understanding, what it's like to actually function out there. And I think there's a huge opportunity with other assistive devices out there right now. This is what our device looks like. I have it right here, so it just fits in your hand. You're welcome to come over and try it out. And we also have videos of people using it. We're going to work on having different attachments for the device. And we did clinical trials last year at the University of Michigan. It actually just got published in the Journal of Movement Disorders. So we showed on average that we were able to cancel 70% of the patient's tremor. We tested this with people with essential tremor. The device is quite complex, but visually very simple. So we have internal microcontroller and accelerometers that are used to help detect the person's tremor and stabilize it. So this is our team. We're very talented engineers as well as business development people. That video they didn't get it to work for us, but come over to our booth and I'll show that to you. We actually launched 2-3 months ago. We've had many people using the device, people writing in saying how much it's been helping. Somebody wrote in saying their grandmother was able to feed herself for the first time in 5 years, and this was like a hugely emotional thing. Right now, actually last month, people just started donating to provide funds for people in economic hardship, and that kind of blew me away. So this month, we're doing an Indiegogo campaign where our company is going to match all funds raised. So to find that, just search Lift Labs. You go to our website and click on Donate. So we're looking to raise enough for 50 spoons. Thank you, and come talk to me.
Thank you very much. And now we have our last startup of the afternoon showing, and this is Berg, who are going to be coming and showing us their smartwatch, which allows us to keep moving and keep talking.
For me, it's a little bit good morning. Good morning for all of you. I'll be a couple of hours now in the States. I flow in to talk to you. I don't know why, but I hope it's going to be good. First of all, I want to show you, we're not good only in speed skating, right? We win a lot of gold medals, but we're very good also in smart watch phones. That's what we developed the last couple of years, and then I'm going to tell you a little bit about this, okay? My name is Herman Vandenberg. I'm the founder of Burg smartwatch phones. We have a clear mission and a vision. We see it like this. I think the wearables, the wearable smart phones, the smart watches are going to change the world a lot. And what you're going to see, people want something what belongs to them. It is a fashion item more than a technological item. Dus we want to combine these two fashions. This is not only technology but also fashion. What makes our product different, and later you can see them in our corner, all our products have a SIM card. All our products is a mobile phone by himself. That means it can do what a Samsung can do and what a Pebble can do or Sony can do. You can, with two-way communication, communicate with your smartphone, but it is more than a Bluetooth device around your arm. Dus if you go out and you go out for golfing, you go out for sport, you still don't miss a phone call. And you can download by Bluetooth easily your phone book and so on. It is proven the last couple of months for Christmas that in many places in Europe our products sold 200 till 300 times better than a Samsung or a Sony. We have an operational advantage. I was so stupid to go to China and open my own factory. Dus it is that we design ourselves, hardware, software, but also we produce ourselves. And we patent everything. The facility, I told you already, we have our own product development team, hardware, software, and we are very good as well to produce it to be sure that we reach the quality standards what companies want. You see here a photo very quickly about our facility, inside and outside. It's all quite modern, cool, and people like to work there. And it's not only a talk, but I make that decision. If you want to create a unique product in China and you want to create a good quality and consistent quality, you need to be there yourself and you need to do it yourself. I also live full-time in China on this moment. You see here the facility where we work. Last year we make around 80,000 pieces, 120,000 pieces. This year we're going to make 1 million pieces. Distribution channels. We choose a lot now for the electronic industry. We make it a mistake to go to the watch industry. It's more the electronic industry. A lot of OEM projects, the patents, especially what is important, the app that you can communicate with each smartphone. Dus you can get your message, you get your telephone calls, and on the other hand also even your WhatsApp messages. The future we're working on, of course, is the health watch, sport watch, and the Android. Android we have with us. Dus we think that our watch is going to be a computer on your arm. We have the cloud. That means all the stuff in Holland, we built it already, that all this information will be for you stored in the cloud.
And I think we might have to wrap it up there.
This is the last one.
Okay.
Last one.
Last one.
Of information about the turnover. We expect this year the turnover of around $50 million with a profit from $8 million. These are the customers who tell us that they're going to buy from us or some already bought from us. And I think that is the whole story. Yes, we need funding to be sure that we deliver the right quality on time to these retailers. Thank you very much.
Thank you.
Thank you.
So you've seen more than 20 startups today. And now's the time to vote. So you should have forms with you, and if you can write down your top selections on... If you can write down your top... Oh, no, it's good. I can't see anything with the lights. Yeah. startups want you to vote for them. They want you to come and visit them. But first, write down your top selections on the form. Come and hand them to us over here by the tables. And we'll have the results for you in about 10 minutes' time. Once we get them all in, it's time to start circulating, have a chat with people. I believe there are drinks, wine and cheese outside. Enjoy yourself. Thank you very much for all your attention. And please enjoy meeting all of the startups. Thank you.
Can I hear a drum roll? No? Okay, so in no particular order, the winners are ChemiSense. Woo, clap. Sculpt. Woo! And come on up, everyone. We're going to take a picture. And last but not least, RX Match. Woo! So we're going to take a group picture. And Julian has a few words of closing. Thank you everyone for coming, and our next event will be in June, and we'll keep everyone updated.
So thank you, Neda. So before we actually end the event, I just wanted to thank the Plug and Play team, especially Neda, and then of course Saeed, Lauren, Scott, Sasha, of course, Ivan, and the entire team. So thanks again, and I guess we'll see you in June.